So different.
Okay.
Wow. Oh my gosh, so different. It's incredible. You're a miracle worker. They look normal.
Look normal.
Yeah.
You have nice contours. Hi, good morning everybody. I'm here with Christy. How you doing, Christy?
Good. Excited.
Excited? Why are you excited?
To get new legs.
New legs. Okay, so we're going to talk about what you've been going through, right?
Right.
Okay, so if you haven't heard about lipedema, lipedema is a disease of the fat which affects it in many ways, but one of the most significant is that it causes a lot of accumulation around the legs that just doesn't go away with typical diet and exercise, and it also causes pain in some patients. And I'm going to let Christy tell you a little bit about what she's been dealing with here.
Yeah. I've had sort of thick legs all my life, even as a little girl. Mm-hmm. And then once I went into puberty, they started getting bigger. Mm-hmm. And then as I got older, my arms started getting bigger, and then I started having pain in my legs, especially my lower legs, very, very sensitive to touch.
And you said something got a lot worse after pregnancy, right?
Yes, after pregnancy, I had a lot more swelling, and then it's kind of stayed in my feet, so they've always been swollen since pregnancy.
Okay. So, in talking to Christy, she has some very significant pain symptoms, right?
Yes.
Are they debilitating to you?
They are, because I can't stand for long periods of time, and I can't do stairs or even walk, 10,000 steps a day.
Right. And I was just examining her legs and just kind of feeling like I normally do, and I've never had anyone so, painful and sensitive, to the light touch that, I think it's light touch, but she's very sensitive. And you're telling me about your arms too?
Yes, very sensitive.
Yeah, arms are also commonly affected in lipedema, about 30% of patients with arms. But as you can see here, it tends to accumulate at the further part out. We call that the distal parts of the limb. So we're going to show you her legs in a second, but her fat is a lot more concentrated down here and relatively sparing the upper shoulder, which is the reverse type of pattern that you see in someone who has normal fat accumulation. So anyways, there's pain in your arms too, right, to touch. Our blood pressure cuff will cause unusual discomfort on her arms too. So we hope to get a very significant reduction in pain symptoms. This is one of the reasons why it's so important to have liposuction, because liposuction truly removes the fat in lipedema, and I don't want to say 100% guarantee, but people get a very significant relief, usually 90% or more of the symptoms being gone. So that's what we hope to achieve, as well as the cosmetic benefit, which gets rid of the kind of stigma that you have to deal with, right?
Yes, because you don't wear shorts, you don't wear short dresses, everything is long, and then in the summer it's really hot.
All right. Can you tell us why are you excited about this? What do you see being different? What's going to be different for you?
I know I'll have a lot more confidence once my legs sort of look normal and not abnormal. And I'm just looking forward to being able to do things that I can't do now. I still have young children, and so I want to be active for them, and right now I can't be.
Okay, awesome. So do you mind if I show everybody?
Sure.
Okay. So let me just, if you'll just stand right there. Okay, so can you raise your arms out just a little bit like this? Okay, you can see Christy's torso is, it's very average, but her legs, very thick. It's, almost, very straightened down toward the bottom around the ankles. Can you turn around for us?
Sure.
Okay. And you can't really see her ankles because where the calf muscle is usually, distinctly larger. It's kind of the same thickness all the way top to bottom. Okay, and then you can see how thin her waist is and how, the thickness on the arm. So this is very classic, and we expect to see a lot of improvement. Now, Christy also has a little bit more advanced component of some edema, right? So as lipedema gets worse, there is a component of fluid swelling that can affect people's legs too.
Yes.
So we're seeing a little bit of that today too. Okay, so without, we'll come back after we've done, you know, at least one leg, and you'll get to see a difference, okay? Hey Christy.
Hi.
Hey, so for our audience, we just finished our first side, which has been a lot today. How was it for you?
It was a little uncomfortable. Just the numbing and then the fluid part was uncomfortable. The liposuction part didn't really hurt at all.
Not too many spots anyways, huh?
Yeah.
Okay, well, okay, so I'm just gonna have you take a look right here.
Oh my gosh.
Okay, so this is the first time Christy's gonna see it because
wow.
we kind of keep it a surprise.
A secret, yeah. Oh my gosh. So different.
Okay, so you ready to stand up and take a look in the mirror?
Yes.
Okay, we have the pads, so
Right, stay on the pads.
yeah, stay on the pads. Okay, it's gonna leak a lot. There's a lot of fluid in there.
Wow. Oh my gosh, so different. You can see my calf.
And you can turn around and your ankle will be a little bit skinnier too. It's just it's filling up with fluid right now. As soon as you stood up, you see all the fluid that's wanting to go down.
Wow.
Okay, so yeah, you can turn around and then just look up behind you.
Wow. Such a difference. It's amazing.
Okay, I'm gonna just take a little bit from the front. Okay, good. Yeah, you can turn around and take a look in the mirror. Are you feeling okay?
Yes.
Okay, good.
You can really see it there.
Okay. Yeah.
Amazing.
Yeah, the fluid's already bulging up down the bottom, which we have to keep squeezing out. So.
Right. Yeah, I can see it.
Okay. Well, we'll maybe come back and do a little bit. Okay. You can take it out here.
All right. Bye.
Hey, Christy.
Hey, Dr. Sue.
Okay. How was the second side?
Second side was easier than the first side.
Cool. Okay. I'm glad that's the case. Sometimes it's worse.
Yeah.
So here, I'm just gonna let you sit up and you can take a look from above first. Okay.
It's incredible. It's incredible. You're a miracle worker.
Thank you. Let's take a look at you standing up, okay? You're going to drain a little bit, okay? Just know that.
Oh my gosh.
Okay, you feeling all right?
Yes.
Okay. Yeah, you go and take a look. I'm just...
Wow. They look normal.
Look normal.
Oh.
You have nice contours. Skinny. Can you see? You can see a calf now.
Yes. Wow. It's amazing. I have shape to my legs. They're not totally straight anymore.
Yeah. Is that what you're hoping to see?
Yes. It's beautiful.
Okay.
It's amazing.
Any words of advice or anything? Wasn't easy, was it?
It wasn't easy. It was not easy. Mine was not easy, but it's definitely worth it.
Yeah.
Definitely worth it.
So we found out today if you have a lot of symptoms of, tenderness, that if you have a lot of symptoms of tenderness, it's going to be tender.
Yeah.
During the surgery, but we made it through.
Yes, we did.
Okay. Thank you. Bye bye. Hey everybody, we're here with Christy this morning. This is our next day follow-up, and Christy's been telling me how she's been doing, so I'll let her tell you guys how was it after the surgery. What did you go through for your first? It's been about 15, 16 hours since the surgery. Why don't you tell everybody how it's been?
Let's see. I did have a little bit of lightheadedness. Not too bad, but I did kind of feel that.
Yeah.
And I think I had probably a little bit more pain because I was tender, very tender to begin with before even having surgery.
What was that pain scale? What would you call the pain scale that you've been dealing with for the last, since your surgery yesterday? On a scale of 1 to 10, 10 being the worst, how bad has it been?
For me, I would probably say an 8 or a 9, only because my pain medicines aren't really taking care of it. But that could just be a physiological thing.
Yeah, the pain, Christy and I have been talking, and I just wanted to just bring this into a realm of reality, because some patients have told me, I watched your videos and everybody says how easy it was. It's not easy, especially when we do some aggressive sculpting.
Right.
And some people, we know Christy had a lot of tenderness from her lipedema. And it was a more difficult surgery yesterday. I mean, I think she expressed that on her video earlier. But yeah, that 8, 9, even 10 out of 10 pain scale can be the first 24 hours. And she's still in a lot of pain right now. The pain medications won't always cover all the pain. Sometimes it just knocks it down a bit. So, we expect everything to get quite a bit better day by day.
Right. And it is better today than it was last night after I got home.
Yes.
So it is getting better.
And I was telling Christy what she can expect, and this is like, for lipedema patients doing knees and ankles, it's the worst of the recovery in terms of length and discomfort, because other parts of the body don't swell bigger than what they were initially. However, the legs can swell bigger than what they were initially, and it can be a different kind of discomfort lasting for a couple of months. Sometimes 3 months, there's still a moderate amount of swelling with kind of tightness and discomfort from tightness and pressure. And so some people don't see the majority of the results up until about 6 months. Now, can you just pan down right here? So anyways, we see her leg from here down to about right there is looking really good. This is still a lot better than it was, but it's out of proportion. You can see it looks real puffy right here because her swelling has already begun. So, and then the swelling has already kind of gotten into the feet also. And we'll see a lot of our patients that have swelling right down to their toes, onto the bottom of their feet. So, reality is this is a very difficult surgery to recover from compared to other body areas that we do, upper thighs, tummies, arms, and such.
Yeah.
So.
But it was still worth it.
Still worth it.
Definitely worth it.
It will be worth it, but this is the period that we have to have patience. Okay.
Right. Yeah.
We appreciate you sharing with everybody.
Oh, sure. Sure, and thank you so much. I'm really thrilled with my results.
Thanks. Do you feel any difference in how they move?
Yes, definitely, because when I was coming up the stairs, I normally have problems coming up the stairs, and I had none.
What kind of problems? What do you mean? Because we haven't talked about this.
Just my knees just don't bend. Like, I couldn't bend them all the way before, and so just walking up and down the stairs would cause a lot of issues in my knees and my kneecaps and stuff. So
would you call it a mobility thing that you feel?
Yes, it was more
better mobility?
Yes, definitely better mobility already.